Medical Monday is brought to you by East Cooper Medical Center.
It's always great when you get to talk to somebody who has had firsthand experience, and today I'm talking with Shuli McKee. You are a repeat customer of Dr. Kyle Kokko from East Cooper Medical Center. Why don't you tell me a little bit of what brought you in to see him in the first place?
So I met Dr. Kokko several years ago. 7 years ago, I tore my UCL. And in my left hand, I saw him, he did a phenomenal job. I don't even have a scar, so I didn't have to go to a plastic surgeon afterwards. I mean, the care was exceptional. Took one look and he was like, I knew what was wrong and I had to do surgery.
Well, so I'm a board certified orthopedic surgeon with a specialty in hand wrist surgery. So we see all sorts of fractures, ligament sprains, ligament injuries, tendon ruptures, tendon lacerations. We see all sorts of trauma come through the door.
So typically, what does the plan of action look like whenever you see these patients? Because you were saying earlier that it's not always surgery.
True. So lots of falls that result in broken bones don't always result in surgery. If we could keep people in cast, if we can immobilize them and get bones to heal, then that's priority number one. Sometimes if they're severe, then obviously surgery is required. And they're often required for ligament injuries, tendon injuries, and that sort of thing.
In Suli's case, you've actually seen her for two separate injuries. The first one being her thumb, right? Tell me about that.
That's right, yeah. She's been a patient of mine for a number of years. Her first injury, she had torn a ligament in her thumb. She had a trip and a fall and injured a very important ligament in the thumb that, contributes significantly to grip strength. Her ligament had pulled completely off the bone and kind of balled up. So it didn't have a chance to heal. This is one of these injuries that sometimes it doesn't ball up and it will heal on its own. Hers wasn't that way. So we did a simple operation. We just repaired the ligament back to where it came, immobilized her in a splint, and then did some rehab to, nurse her back to health.
And then for the wrist injury, she's in a cast now. So kind of tell me what happened there.
Another fall. So yeah, she's in a cast now. She actually broke her wrist. She broke a very common bone in her wrist called the distal radius. And, we got x-rays. We saw that it wasn't a bad fracture. So this is a very good example where we don't do surgery on everybody. We placed her in a well-fitted cast, and we're watching it and making sure that this thing heals. And so long as it heals, we expect her to have very good range of motion, excellent strength, and for her to really get back to living her active lifestyle.
Love that. Now, obviously, you can't prevent accidents from happening, but there are some, different repetitive movements that you can do or sports that you do that can result in injury.
Yes.
Tell me a little bit more about that.
Yeah, so we like, our athletes in particular like our skating athletes, our, riding and running athletes to, wear their protective gear. Protective gear, whether it's knee pads, elbow pads, wrist guards. We would love all of our patients to do that. We see a lot of pickleball players now who are breaking their wrist who, if they had a wrist guard, might not have broken their wrist.
Perhaps.
So, protective gear is very important to live an active lifestyle to prevent us from having to do our jobs.
Now, obviously, you've known Suli for years now. What is the most rewarding part of being able to see her process every time you get her back to the way she was?
Yeah, well, it's her and many of my patients, just getting you back to where you started, getting you back to, 100% or close to it, getting that form and function back. She loves to cook. She's back in her kitchen. She's able to do the different things she likes to do. She's very active. So as far as athletics and staying active, she's able to do all those things. We hope once we get her cast off that, she'll again be at her normal form.